The practice code numbering system for healthcare suppliers has received a shot in the arm. Now, according to PCNS, new technology is bringing more transparency and convenience for service providers. The practice code number is a unique number allocated to registered healthcare suppliers who render services in South Africa, Namibia, and Lesotho. PCNS head Lamise Scholtz joins us now. Good evening. Thanks very much for talking to us this evening. First of all, why should South Africans care about this development? What does it do to the for the ordinary person?
So first, thank you very much for inviting me to talk tonight. Why should they care? Because basically the number facilitates the payment on behalf of a patient or medical scheme member. And the number has been around for more than 30 years. It has actually seen a number of changes over the past couple of decades. It is a registered, regulated number. However, we have been administering it on behalf of the Council of Medical Schemes, and as such, we have taken it now to go into the new dispensation with the new changes and the new transformation that's about to come.
Mm-hmm. But which means what exactly for me? Say I'm a medical aid member for medical aid X.
Yes.
You know, how is this system going to improve my interaction with my medical aid, knowing, of course, the challenges or the issues that people always raise about medical aid schemes?
So a healthcare service is basically a healthcare practitioner in a particular type of facility. The Health Market Inquiry identified that there were some gaps with respect to how healthcare services are actually rendered and where these services are. What the practice code numbering system do is try to locate exactly where these services are. A medical scheme obviously has a population. That population needs to be serviced. It uses the numbers to allocate and see where these resources are to purchase those services on behalf of its scheme. So if medical scheme A has a population in Eastern Cape, Western Cape, and in Gauteng, majority-wise, it can look at the practice code numbering system, see how many services is available for what kind of services in which areas. And then depending on the burden of disease or the profile of that particular scheme, they would be able to then determine if there is resources or capacity for them to be able to contract with for that particular population that they're looking after.
But then what were the gaps that you're trying to fix by coming up with this new system now? What were those identified gaps?
So the system the system itself, but the whole ecosystem, the whole healthcare ecosystem has been very fragmented. We have a public and private sector, yet we operate under one healthcare regulatory environment. And as such, we have been trying to kind of converge these two worlds to make it a little bit more simplistic, to be able to understand where these on how these services are rendered. So how the practice code numbering system works currently is it facilitates collating all that information in the healthcare universe and put it into a simple database, which then generates the number, which then schemes can use to facilitate the payment. How it actually benefits the patient at the end of the day is that when an invoice gets sent out, they know that that practitioner is an actual registered practitioner with certain types of services that they should have been able to render. The scheme can easily facilitate that payment, and that payment can go quite quicker through. So the faster...
Is it wrong or naive of me to then conclude that this only really helps the schemes so that they track the money?
Yes. Well, it helps the schemes track the money, but so you're the patient. You have a contract with your health service provider. right, with your doctor. The doctor has a contract with a scheme. Some of them are part of the networks, and even if they're not part of the network, you as the patient who is then the medical scheme member has a contract with the scheme. On behalf of the scheme and you as the member, there has to be an agreement between how this payment will be facilitated. And the faster we can get these numbers updated so that people can understand what service they're buying or understand the services that is being rendered for the payment to go through, the quicker the system can churn in terms of that. If we do that well enough, the funding mechanisms will fund what services needs to be provided, where the patient is then not out of pocket at that particular point in time.
In other words, is it going to help me not pay out of my own pocket because the medical aid scheme doesn't recognize a particular provider? Is that the benefit to me?
So schemes will contract with various health service providers within their network, but if the practitioner has a practice number, they have to pay even if that person is not part of their network.
And that is what still doesn't help me personally.
As a patient, no, I think the thing is it does help facilitate the relationship a little bit easier, because generally then you would have to fork out the money and you'd have to pay on behalf.
Okay.
The relationship is still between the scheme and the health service provider. We just in the background facilitating a lot of the information that it needs to be collated. And I think a lot of the times it's not we're not in the forefront of what needs to happen, but in the background what needs to happen, we do make sure that that information is there to support the overall system and ecosystem that has to operate.
Okay. Well, let's hope that it does indeed help everybody at the end of the day. Thanks very much for coming through. Practice Code Numbering System Head Lamise Scholtz.